Unsafe clinical practices in pain management and psychiatric care. Those are the latest findings released from a clinical review at the Tomah VA. The VA Deputy Secretary was in Tomah today to release the results of this initial review as investigations continue into the overprescribing of opiates at the medical center. News 8's Brittany Schmidt joins us now with a closer look at the results.
Mike, the clinical review was conducted by Interim Undersecretary for Health Carolyn Clancy. The results paint an alarming picture, giving a sneak peek at what has been happening at the Tomah VA. After allegations of overprescribing opiates to patients surfaced in January, a clinical review was ordered.
I think everyone is aware of the visit of the clinical review team just over a month ago.
For 30 days, a team of 9 clinicians assessed opiate prescribing habits, employee interactions, and clinical leadership at the Tomah VA.
The team submitted its report on the 4th of March. Based on a review of medical records of a sampling of 18 patients.
The team determined there are unsafe clinical practices in areas of pain management and psychiatric care at the Tomah VA Center.
More specifically, 6 of the 18 cases revealed that patient harm. The example given was a patient fall. Patient harm could be at least partially attributable to prescribing practices.
The review found the opioid prescriptions at the Tomah VA are actually lower than they are on average across the VA system.
About 11.5% of Tomah patients receiving a prescription for opioids compared to about 14.5% of patients across VA.
However, Tomah patients are 2.5 times more likely to be prescribed higher dosages of opioids.
There was also a higher incidence of both opioid and benzodiazepine medication in combination than elsewhere, roughly twice than across the department.
The team of clinicians also found there is a continued culture of fear among employees, and it has compromised patient care.
We can't have people, frontline employees, that are afraid to raise their hand.
Based on those findings, the VA Deputy Secretary is calling for a more in-depth clinical review.
That has been commissioned with an outside organization that routinely conducts these kinds of clinical reviews for VA as well as for the private sector.
The VA Deputy Secretary says these results are being taken seriously, and he is determined to fix the problems.
My commitment is we will follow the evidence wherever it leads. No one is immune, no topic is immune. Okay? No sacred cows.
When the investigation started, the 2 individuals at the center of it, including the Tomah VA's Chief of Staff, Dr. David Houlihan, were removed to administrative duties. However, with these findings, the Deputy Secretary has put them on administrative leave. He said it is not a disciplinary action, but a precaution to make sure they don't interfere with the ongoing investigations underway.
Thanks a lot, Brittany. A hearing for the congressional investigation into the Tomah VA over-medicating patients will be held at the medical center on March 30th. It will give the staff and patients a chance to weigh in on the issue. It's scheduled to start at 1 o'clock in the afternoon.